All right, great. Good afternoon. My name is Tyler Davis. I get to serve as the CEO for ECU Health Behavioral Health Hospital. It's really a privilege to welcome all of you here today to talk and share a little bit about what this facility means for rural Eastern North Carolina. Since opening in December of last year, our care teams have cared for more than 150 patients facing acute behavioral health illnesses, providing timely and specialized inpatient care. Our 144-bed hospital was built very intentionally to meet a clear and growing need. Across the country, 1 out of 5 Americans experiences a mental illness, with reports of as many as 45% of those people not receiving the care, not having access to the care that they need. Here in rural North Carolina, we're bringing that care much closer to home for folks, ensuring patients have access to timely care, high quality behavioral health services, when and where they can access that care. Providing this crucial care relies on a skilled and compassionate care team. We have more than 100 clinicians and staff already providing care to those 150 patients we've served so far, and we have plans to expand north of 300 by the time we are fully up and operational. Through our partnership with Brody School of Medicine and ECU Health, we're also designing a state-of-the-art clinical experience and training ground for the future generation of psychiatrists and providers for this region. I want to recognize the leaders, the partners joining us today, including representatives from our state and local government, from healthcare organizations, and our community. Thank you for your support in the shared commitment to expanding behavioral access to care across this region. Governor Stein, it's an honor to have you with us today, and I especially want to thank you for investing your time in us and in this care, and for your focus on behavioral health as it continues to, as we continue to serve the population here. So it's my privilege to introduce Governor Stein.
Tyler, thank you for the introduction, and thank you and Brian and your entire team at ECU Health for hosting us. I'm pleased to be joined by the Secretary of the Department of Health and Human Services, Dr. Dev Sangvai, and it's good to have Representative Brown and Representative Reeder here. We thank you for your leadership in ensuring that the people of Eastern North Carolina can get the health care that they need without having to drive all the way to the Triangle. Just had a chance to tour the ECU Health Behavioral Health Hospital that they just opened up in December. The facility launched as a joint venture between ECU Health and Acadia Healthcare. It's a 144-bed facility meant to provide inpatient and intensive outpatient psychiatric services for adults and children alike. I eagerly look forward to the lives they change at this facility. There is a lot of impressive and important work being done here in Pitt County. In October, along with Sheriff Dance, we visited the Integrated Family Service facility located just down the road. This is a Behavioral Health Urgent Care Center, a BHUC. It's run by Ms. Natasha Holly, and it offers a range of crisis care services, mobile crisis care, co-responder services, and school-based therapy. Both this behavioral health hospital and that urgent care center are helping the region and state meet 2 critical goals. We want to connect more people to the mental health care that they need, and we want to bring that care closer to their homes. In February, I signed an executive order to strengthen and better connect our behavioral health and criminal justice systems to better protect North Carolinians. The vast majority of people who struggle with mental health challenges pose no risk to themselves or to others. But a small minority who may have paranoid delusions can pose a risk to public safety when their serious mental illness goes untreated. So we need to work to get and keep people healthy, and in so doing, we will keep people safe. The executive order supports people in crisis at different stages. First, when a person who experiences a behavioral health crisis is interacting with law enforcement or the mental health care providers, even though no crime has been committed. Second, during incarceration for those who had committed a crime. And third, when people who were incarcerated re-enter their communities. But we know that success will come from working together. When law enforcement and healthcare providers are aligned like we are seeing here in Greenville and in Pitt County, and when Democrats and Republicans can work across the aisle to protect Medicaid and to support initiatives that work, like this one. Last month, I rolled out a critical needs budget proposal, which would direct $1.4 billion to the state's most pressing needs. This is in addition to the short session budget that will be considered this summer. Several of those needs are being felt right here at ECU Health. First of all, we urgently need $319 million to fully fund Medicaid. Medicaid covers more than 3 million North Carolinians and is the primary payer of behavioral health care across the entire state. It supports rural hospitals and other providers, so whether you're on Medicaid or not, everyone benefits from a strong Medicaid program. If we do not fully fund Medicaid well before the end of the fiscal year, health care for millions of North Carolinians will be in jeopardy and the healthcare system will be severely weakened. Second, my critical needs budget pays our state nurses and behavioral health care technicians better. I'm calling for a 10% raise for state nurses and healthcare workers, some of whom treat people with severe mental health illnesses in our state hospitals. We currently have hundreds of inpatient beds that are sitting empty. They have sheets on them, they exist, they're there, but not a person in them because we do not have enough staff to care for those patients. It is a tragic waste. Let's invest in the public servants who treat sick people, helping them to get healthy and making all of us safer. So when the General Assembly members return to session later this month, I look forward to working with them to invest in people's health care and to make the jobs that we depend on more attractive. Thank you. And at this point, I will invite forward Secretary Sangvai from the Department of Health and Human Services.
Thank you, Governor, and thank you for your leadership and for making health and wellness such an important part of your agenda and platform. Thank you to ECU Health Hospital for the opportunity to be here. What a beautiful facility. I mean, our tour was short, but what I got out of the tour was potential, the enormous potential, not only to have impact as a facility, but on the entire region. Also, thank you to the leadership more broadly of ECU Health for having the vision and the idea to put something like this together along with Acadia. As already shared, I have the privilege of serving as your Secretary for Health and Human Services. And as I said, that one of the things we constantly talk about is this idea of whole person health, and it is so vital to what we're doing in the department. There is no health without mental health, and so a facility like this really allows us to focus on the importance of behavioral health and mental health. Being able to access quality mental health care at facilities like this facility helps us make the vision of whole person health a reality. Our department is not only working diligently to improve access to quality care, but it's really thinking through strategic investments. And so when you have the public-private type of partnership that you see here today, it gives us a sense of where the department can think about investing its knowledge, its energy, and its resources. I'm going to share a couple examples of what we've done over the last year that are going to complement the great work that this hospital is going to do. Over the last year, the department has helped fund the opening of 7 new behavioral health urgent care centers. You heard the governor talk about his experience in visiting one of those. Those are 24-hour facilities, a place for someone to go to when they're in the most immediate need, but maybe not emergent need. And it really reinforces something that we're focusing on in the department. When it comes to behavioral health, there's 3 things we want everyone to have. We want them to have someone to call, someone to respond, and a safe place to go. And we've seen how this facility helps us materialize that vision. We also launched 2 mobile opioid treatment centers, with more on the way here later this year. These mobile opioid treatment centers are licensed programs that provide medications for opioid use disorder, along with other supports for treatment to ensure people can sustain their recovery. We want to ensure that these mobile OTPs can reach all 100 counties in North Carolina. You heard a little bit about the workforce, and thank you to the governor for putting forth the critical needs budget and the importance of particularly on nurses and behavioral health techs. We have empty beds. As soon as we fill those beds, we're going to help the detention centers, we're going to help emergency rooms, we're going to help other facilities where people need to go for critical care. You heard a little bit about Executive Order 33, so I won't talk about that. I'll end by saying that we are dedicated to ensure that every North Carolinian has access to care that they need to thrive. And improving our mental health system is an important step. So I look forward to continuing our work with the administration, with partners like ECU Health and Acadia Health to make our vision of a healthier North Carolina a reality. Thank you.
Secretary, thank you. And at this point, we'd be happy to take questions, and you can direct them to the Secretary or me.
Yeah, go ahead.
Yeah, so obviously rural healthcare could be a challenge in any state, but particularly behavioral health. How important is it to have facilities like this in rural communities?
It is critical. We need to have people be able to access the health care they need where they live or as close to where they live as possible. North Carolina has lost a lot of rural hospitals. Over the last 15 years, very few states have lost more rural hospitals than North Carolina has. So expanding Medicaid was critical because it meant that more people had health insurance to pay for the care they got when they go to the hospital. But it's a real struggle. And so ECU plays a critical role. They are a regional healthcare provider, and they're drawing in from 29, how many counties? 29. They draw in from a 29 county service region. And that's just an incredible demand on their resources. But it also means that we need to have more clinics and more emergency care options for people where they live.
Do you have any concerns with the General Assembly about trying to pass this critical needs budget?
I do, only because we're the only state in the country that hadn't passed a full budget. And most people know that we didn't pass a budget last year, but what people don't fully realize, we've not passed a full budget in North Carolina for 2.5 years. That means that we've not kept up with the pace rate of inflation, 6% inflation. We've not kept pace with the rate of population growth. We're one of the fastest growing states in the country, the third fastest in terms of number of people. We've added 325,000 people since the last budget we passed. There is incredible demand on public services, but we've not passed a budget that reflects that. So things we're just limping along. There are some things that are near breaking, which is why I suggested this critical needs budget. Let's take some of these things off the top that haven't been addressed. Our troopers, they're paid 49th in the country starting trooper pay. Our correctional officers, 49th in the country in starting correctional officer pay. Our teachers, 43rd in the country in teacher pay. We are not a poor state in North Carolina, but we treat our public servants as if we were. And that's wrong because they are the ones who keep us safe. They're the ones who keep us healthy. They're the ones who educate our children. So I'm eager to sit down with the legislature so that we can address the real needs of North Carolina. But I wish I could say with 100% certainty we'll have a full budget that is fiscally responsible. We haven't passed one. They have not passed one in 2.5 years.
Thank you.
What's your thoughts on the Leandro ruling by the state Supreme Court?
I'm very frustrated by this court simply ignoring the precedent that it itself had written just a couple years ago, clearly ignoring the plain language of our Constitution. Our Constitution guarantees every school child a sound basic education. I do not believe that the quality of your education should depend on what your zip code is. Where do you live? I think the people of Pitt County, the kids in Pitt County, deserve just as good an education as those in Wake County. And the Supreme Court, by rendering this decision and throwing out its past precedent, is essentially slamming the doors of opportunity closed on our children across the state.
After taking your tour today, can you see room for growth here?
Well, I'm incredibly excited. It was a very impressive tour. You could tell by just meeting the people who work here. Folks who go into this line of work, they have huge hearts. They want people to be healthy. They want them to be well. There are 6 units. At this point, only one of the 6 units is operational, but they have a plan to get as many of them up and running as quickly as we can help them find the workforce that they need to staff all these beds. Once they're at full capacity, Tyler was telling me it's almost certain they're going to need to add more beds, and I have no doubt. we have real mental health challenges in this state. We're a fast-growing state. We have well over 11 million people today. We used to have just a few million less than that just a few years ago. So when you add that kind of population, you're going to get people with all kinds of health conditions, and we need to make sure that we have the resources to serve the people in the way that they need service.
Is there anything you can take here from this tour and apply it to maybe a state level?
Yes, we need more facilities like this one. And it is an intriguing public-private partnership where Acadia joined with ECU Health and said, let's put our combined resources together to meet the needs of the people of Eastern North Carolina. And that's certainly a model that the Secretary and I can take back and study. Well, thank you all for being here, and more importantly, thank you all for the work that you do.